Hello and welcome to Exposed Teeth. I'm Dr. Rachel Hall and I'm the founder and principal dentist of Evolved Dental Healing in Kenmore, Brisbane. I've got over 25 years experience and I've been practicing holistically since 2001. I like to think of myself as not your typical dentist. I'm a passionate opinion leader and I like to challenge convention and I want to empower people to make better dental and health choices. We've been helping thousands of people to have natural, healthy smiles. So on tonight's episode of Exposed Teeth, I am going to talk about amalgam and why you might want to consider having it removed and answer some of your questions around that. So thank you for taking the time to watch and we'll kick off. So one of the major services I offer as a holistic dentist is safe amalgam removal. So it doesn't come as a surprise if I said to you that I'm frequently asked questions like, what is amalgam removal? Why is it done? What's involved? Is getting my amalgams removed difficult? Is it expensive? And how long will it take? And what other things do you need to bear in mind? So I'm going to do a series of videos on amalgam removal called Amalgam Removal FAQs. And I'm going to address and answer as many of those questions as I can. So firstly, let's start by looking at what amalgam is. Dental amalgam is a filling material called silver filling that's been used for dentists for over 150 years. If you have a peek inside your mouth and you see those silver metal fillings or metal fillings that look black, they're often placed in your back teeth. Well, those are amalgam. So why should that concern you, or why should people be looking at replacing them? Well, dental amalgam is a mixture of silver, copper, tin and other metals mixed with 50% or more mercury. Now, mercury is a toxic heavy metal and it's detrimental to health. Yet, as dentists, we're trained that it's okay to mix it up as a filling material and implant it in your teeth. Well, if this is the case, then surely it must be safe. Well, not exactly. Because what happens is studies have shown that the mercury from the filling actually vaporizes and leaches through the lifetime of you having that filling in your mouth. And that's like having a little tap that's drip feeding mercury into your body every time there's any warmth or friction or pressure put onto those fillings. So if you have a hot meal and a hot drink, you clench or grind your teeth, those fillings are releasing mercury vapor. That mercury vapor then enters into your bloodstream via your lungs, where it quickly passes into the cells of your brain and other organs. Now, once it's in your body, it's really quite hard for your body to get rid of it, and therein lies the problem. So mercury is one of the most toxic of the heavy metals, and having it in your body can lead to a whole host of complications and potential health issues. And that's why holistic dentistry advocates amalgam removal and not using amalgam as a filling material. So those amalgam fillings that are sitting there in your back teeth are acting as a reservoir for mercury. It's constantly drip feeding day after day more and more mercury into your body. Now, having amalgam fillings in your teeth makes it harder for your body to actually detox and remove mercury from its tissues and cells. So more and more accumulates over time. Now, if you're eating a poor diet and you don't have all the nutrients and minerals that you need, mercury is going to accumulate faster. Also, if you've got genetic predisposition to not being able to collate and detox, then you're going to be a susceptible individual. It's a little bit tongue-tied there. Now, I'm not going to just say go rush out and get your nearest dentist to take out your fillings. Don't do that. Don't demand that that happens. Because what happens is when those fillings are drilled, significant volumes of mercury get released from your filling because of the massive amount of friction that the drilling actually creates. And friction and heat of any kind, from chewing, hot drinks and foods, as I've mentioned, even brushing your teeth, the dentist drill especially is going to cause mercury to vaporize from the amalgam. Now, the mercury vapor coming off your filling via the drill ends up being inhaled by you and also the dental team, so the dentist and their assistant, and it can be more harmful to you than if you'd had the filling just left alone. So the removal and the replacement of the amalgam needs to be done carefully and safely by a dentist who understands the implications of mercury and is trained in the safety protocols and technique to protect you from what that mercury can do. So the silver filling, I'm just going to repeat myself a little bit here, is not a true alloy. It's actually that mixture of metals and 50% mercury. And there are millions of these fillings being placed in people's teeth every day. You know, people say to me, well, dentists don't use it anymore. Well, actually they do. I was also told that they took the mercury out of fillings 20 years ago. Not true. So if these are some of the dental myths that you believe, I urge you to have a look again. So mercury is as dangerous as lead and arsenic, and it vaporizes from your fillings. People with amalgam fillings will exceed occupational exposure limits that have been set in Europe and North American countries. So if you've got more than 4 tiny little amalgams, you're running a significant health risk from the mercury. And in children, it's only 2 amalgams. I mean, I cannot believe that dentists will still place amalgam in children's teeth. So you're going to be absorbing mercury from that as well as from your environment. And many countries such as Germany and Sweden and Denmark severely restrict their amalgams. Now in Europe, they are about to enforce a ban, and the same in New Zealand, a ban on the use of amalgam fillings in children, pregnant women and people with medical conditions because they are that concerned about the health risks from the mercury leakage. So what happens to that mercury vapour? Well, it leaks continuously from the entire life of the filling, from the moment it's placed to the moment it's gone. That filling will leak mercury for longer than you're alive. But when we drill it, or when you chew on it, you also get particles coming off that filling. You're sort of chewing them and you'll ingest them during the day. The mercury is going to pass through your cell membranes, across your blood-brain barrier, and it's going to damage your nerve tissue and also your pituitary gland, which is in charge of controlling all your hormones. So the vapour is the primary route at which you're going to get mercury from those fillings. And it's going to accumulate over time and cause a potential health threat. Now look, if we placed your filling and you got sick a week after and you all got the same symptoms, we'd know for definite, hey, that's coming from the mercury in your filling. It doesn't happen like that though, because it's a slow accumulation. It may not be till 10, 20, 30 years later that you develop health issues, which we then consider normal as part of aging and processes. So there have been radioactive studies that talk about mercury that's been mixed into the filling and then tracking where that goes and seeing that the radioactive mercury ends up in the kidneys, the brain, the thyroid and the stomach. So what does the mercury do? It attaches to your cells and it blocks the biochemical processes. So it interferes a little bit with uptake of nutrients and enzymes, the way messages are sent from one cell to another. And it competes with your minerals. So it's essentially depleting the body of them as well at the same time. You need minerals for your body to work, and without them, you're going to end up low in energy. So the mercury impacts the functionality of the body. It impairs your immune system, your nervous system, hormone production, kidney function, cardiovascular system, and on and on and on. So some of the symptoms of mercury have been very well documented. There's been toxic exposure, chronic long-term exposure. So the literature shows that mercury has been associated with a lot of problems from Alzheimer's disease, autoimmunity, infertility, food allergies, MS, thyroid problems, and on the list goes. It's even been suggested that amalgam is linked to fatigue, depression, poor memory, and psychological disorders, tremors, insomnia, emotional problems, irritability, headaches, weakness, blurred vision, and memory problems. Now, your nervous system is the most sensitive to mercury toxicity, And so it binds really tightly to that because it's high in fat and high in sulfur, and mercury forms these long compounds with that. Other studies have shown that it's also taken up in the nerve endings in your hands and feet. And so you can end up with like pins and needles and numbness and change sensations. So unless it's actively removed from the body with detox, it has a very long half-life. So it stays within your brain for about 15 to 30 years. So let me explain what that means. It takes 15 to 30 years for half of the mercury in your brain to be excreted, then another 15 to 30 years for half of that half, and so on. So that's a long time. So to eliminate mercury, our body has excretory pathways and detox. So the most common is out through your urine and your feces. And there are agents that can be used to help expedite that for detox and chelation. But the most important part for you to be able to get rid of mercury from your body is to remove the source of it. And that includes taking out those silver mercury fillings. Now, as I said before, please don't just rush out and ask any dentist to do this. You need to seek help from a dentist who is specially trained and knows how to properly remove them without giving you an unnecessarily high exposure to mercury. Once it's been removed, they should also be recommending supplementation with minerals and antioxidants, dietary modifications, either through their own training or through the support of a naturopath or an integrative GP. So really, essentially, if you've got amalgam fillings, then you need to be looking at, your health, what's going on in your body, and considering whether your mercuries could be the source of the issue. So by removing those fillings, it actually helps your body to detox, process stored mercury. And I'm going to talk about in future episodes how we do that, how we make it nice and safe for you, and what steps you can take for yourself. So I hope you found this useful and interesting, and thank you very much for joining me. I'm Dr. Rachel Hall of Evolved Dental Healing, and this has been Amalgam Removals FAQs, another episode of Exposed Teeth. Thank you very much.